I suspect my toddler may have autism, Dr. Matta. I see some red flags. Should I be concerned? What is the next step? A very common question I get from concerned parents, and rightly so. That's what I will be discussing today: how to screen for autism in a toddler, what questionnaires can be used, when to screen, and what to do with the results of the screening, and what can you do at home and to screen and monitor your toddler yourself. Make sure to watch my previous YouTube video on early sign of autism in toddler. There is a link right here. And welcome to Autism Insights MD. I'm Dr. Matta, your source for clear, simple, and actionable guidance on navigating autism. I use and recommend two screening tools in toddlers. There is a general developmental screening, ages and stages questionnaire, and then there is an autism specific screening using modified checklist for autism in toddlers, revised and follow up, commonly called as MCHAT screening. Do you know that developmental and autism screening should normally happen at well child visits? And the answer is yes. Now, let's see when these two screenings should normally be conducted. American Academy of Pediatrics recommends that the general developmental screening should be conducted at 9 months, 18 months, and 30 months. And the most commonly used questionnaire is Ages and Stages questionnaire. And the autism specific screening with MCHAT should be conducted at 18 months and 24-month well child screening. These screenings are done on all kids, and therefore they're called universal screening. Has your toddler has had this screening? American Academy of Pediatrics also recommends developmental surveillance on top of the screening. What is the difference? A developmental screening is episodic, like Ages and Stages questionnaire or the MCHAT screening, and is conducted at specific ages for all children, irrespective of the risk factors. That's why it is called universal screening, as we discussed earlier. These can also be targeted screenings, which are conducted on kids who present with risk factors. Surveillance is a brief, ongoing, and continuous assessment which assesses for developmental landmarks and addresses parental concerns at each of the well child visits, and both have their distinct roles. Developmental and autism screening should happen on toddlers during specific visits using two validated tools, Ages and Stages questionnaire or the MCHAT screening, or similar other tools can be used. Let's talk about these tools. We'll talk about Ages and Stages questionnaire first. Ages and Stages questionnaire can be used between 1 month to 66 months of age. It's completed by a parent. It's available in multiple languages, and it can be completed either online or on paper. It screens for different milestones: motor, fine motor, communication, problem solving, and personal and social behaviors. It can be used to uh, identify specific delays like a speech delay or a global developmental delay. Ages and Stages questionnaire is a point of care test, so it can be scored quickly and easily, and the intervention or the next steps can be planned right away. There is a special form of Ages and Stages questionnaire called SE2, which is focused on social and emotional development of your child. American Academy of Pediatrics also recommends that all toddlers should be screened for autism at 18 months and 24 months using a validated tool like MCHAT. MCHAT can be used from 16 months to 30 months. There are other tools which can be used at younger and older ages. It's a two-stage parent-completed questionnaire. It's available in multiple languages. It can be completed online or on paper. Again, the scoring is very easy. It can be automated. The scoring can be done with hand. Reporting is available right away, and the next steps can be planned. Dr. Matta, I just completed the autism screening and the MCHAT score is 2. What does that mean? That's a very common question I get from the concerned parent as I enter the room to complete the visit. Let's uh, learn what different MCHAT scores mean and what should be the next steps. MCHAT score of 0 to 2 means a negative screening, very reassuring for the parent and has a low risk for autism. No follow-up is needed in most cases. The child can still be referred for early intervention as needed if other parental concerns are there. The child should be rescreened at 24 months of age if the child is younger than 2 years at the time of the first screening. A score of 2 or below is considered normal on MCHAT screening on autism. What if the score is higher? A score of 3 to 7 indicates moderate risk for autism. In that case, administer follow-up questions from the screening. And if the score is 2 or higher on the follow-up question, that child should be referred for early intervention and further diagnostic studies. A score of 8 or higher indicates a high risk for autism. We do not need follow-up questions in this case if the score is 8 or higher, but that child should be referred for early intervention services as well as full autism diagnostic services. Early intervention may include speech therapy, occupational therapy, hearing tests, or other services depending upon the situation of the child. Important concept here is that the early intervention and the diagnostic evaluation for autism are two parallel tracks, and intervention does not have to wait for a diagnosis. Earlier the intervention is made, the better is the prognosis. Also, I think it's important to remember that if the child's MCHAT score is 2 or below, that child can still be referred for intervention or diagnosis if the concerns continue to persist. And any toddler should be rescreened if the parental concerns continue to persist or new behaviors come forward. Parental concerns should supersede the results of any screening. So finally, to put it all together, all toddlers should be screened with MCHAT and ASQ at recommended ages. Toddlers with moderate to high risk for autism should be referred for early intervention and full diagnostic evaluation at the same time. We should not wait for the early intervention pending a formal diagnosis. So, how can you monitor your child's development yourself at home? I recommend the following resources. For general developmental screening, you can use a CDC milestone tracker app, or you can use pathways.org baby milestone app. And you can conduct the MCHAT screening online yourself. Go to autismspeaks.org and you can complete the screening. See info cards here are for the website, or see the links in the video description. And if you have medical concerns, you should get your toddler screened with a medical professional. In this meantime, stay engaged with your toddler. It's fascinating to watch them grow. I will talk about autism diagnosis in a future video. Until then, like, subscribe, and follow at AutismInsightsMD, empowering neurodivergence together. Thank you so much, and thank you for watching.